Hi guys, now I'm going to tell how to remember easily the difference between different types of shock. Shock is nothing but a state of low tissue perfusion for inadequate normal cellular respiration. So you know different types of shocks are hypovolemic shock, cardiogenic shock, obstructive shock and distributive shock. Hypovolemic shock is nothing but loss of fluid or loss of blood in case of trauma, in case of surgery, in case of GA losses. Cardiogenic shock is nothing but failure of heart to pump blood. It's in the case of MI, arrhythmias, and valvular insufficiencies. In obstructive shock, some extra cardiac causes like pulmonary embolism, tension pneumothorax, and pericardial tamponade is obstructing the heart to pump blood. In distributive shock, which is mainly seen in sepsis, anaphylaxis, and neurogenic shock, which is nothing but due to severe peripheral vasodilatation. In order to know the difference, first you should know about the distributive shock. What is distributive shock? Is nothing but a peripheral vascular dilatation. Means there will be decreased in the systemic vascular resistance. So the amount of oxygen extraction by the tissues is decreased. So lot of amount of blood is staying in the blood vessel. So the lot of amount of blood is returning into the heart. Means the percentage of oxygen saturation returning to the heart is also high. So the heart will pump more amount of blood. So there will be more cardiac output. So all shocks will have low cardiac output except distributive shock, which has high cardiac output. Because of high cardiac output, it is called as warm shock. Remaining shocks are called cold shocks. As a distributive shock is having low systemic vascular resistance, remaining shocks will be having more systemic vascular resistance. And in distributive shock, the amount of oxygen returning to the heart, nothing but mixed venous saturation is high, but in remaining shocks, the mixed venous saturation will be low. And coming to venous pressure, has lot of blood in the blood vessel, so the venous pressure will be very low in distributive shock, and remaining shocks the venous pressure will be high except hypovolemic shock where we have loss of blood. So there is no volume, no pressure. So venous pressure is low in both hypovolemic shock and distributive shock. Coming to base deficit. In base deficit is nothing but amount of base molecules needed to maintain the pH at 7. So in every shock, there will be SLR respiration, lactic acidosis. So base deficit will be high in all shocks.